This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
I have a question here from Catherine. She says, I'm 37 with blocked fallopian tubes. I've done 4 fresh cycles with 1 chemical pregnancy. I'm about to do my 5th stim cycle and hoping for success. So far, our embryos don't make it to freeze, despite eggs and sperm looking good. Wondering if I should request immune protocol?
Yeah, the immune protocol is aimed at implantation after you've created an embryo. It's not going to change your embryos. And even then, the immune stuff is not totally convincing scientifically to work. I am involved in using it, but I would reserve it for very few patients. I hope whoever's looking after you is not just doing the same thing again and again and again. I'd certainly be looking at what we can do to improve the egg quality, be checking the sperm for DNA fragmentation, because the sperm contributes to eggs not reaching the blastocyst stage for freezing. I'm more than happy to look at what's happened to you. If you'd like to make a consultation and we go through the results, more than happy with that. Just get your GP to refer you. I'm happy to do it on Zoom if you don't live close to southern Sydney. Yeah, after 4 cycles, certainly would be looking very carefully at a number of issues. I hope that the doctor that's looking after you has done that and is not just ploughing on saying things about, well, the more times you try, the more chance you've got. I mean, it is a correct statement, but not without more further investigation of the issue. Because at 37, you should be getting good blastocysts.
Christy says, any advice on donor eggs?
Donor eggs are scarce in Australia. The good news, and the majority of my patients over the years that have needed donor eggs have gone internationally, and there certainly are, with the borders coming down, there are going to be options to go overseas, either to the States. Hawaii, I understand, is open from Christmas. Spain is open now. So, there are options, and I'd be more than happy to direct you to one or other of those if you wanted to discuss further about getting donor eggs.
I have had 5 FET cycles with no successes, and I'm 44.
It all ties back into what I've been talking about in relation to quality of eggs leading to quality of embryos. I would certainly be talking to you normally after 2 attempts of not getting what appears to be a good embryo to succeed at your age. I would be talking to you about doing genetic testing of the embryos. So what we know from genetic testing of women at 44 from their embryos is that about between 90 and 95% of them are going to be genetically abnormal. In other words, if we did that and found it to be genetically abnormal, we wouldn't put it back. However, if you're in the 5 to 10% of embryos that are genetically normal, your pregnancy rate immediately jumps up to around 50-50 despite your age. Because what we're doing is finding that genetically normal embryo that's formed a blastocyst. So it's got all the way down the track ready to implant in the uterus, and it is genetically normal. So rushing off to donor eggs, it's probably going to be where you are, but maybe if you haven't had genetic testing of your embryos and you're still producing good numbers of eggs, and there are women at 44 who are lucky to produce a few eggs, I'd be pushing on and at least do 1 genetic testing of your embryos.
Let me go to Amanda's question. Hi, Prof. I'm 40. I can get pregnant easily, but cannot sustain it. I've fallen pregnant 6 times this year. I keep having chemicals. Is this due to poor egg quality, or could there be other reasons to explore? How many good eggs should I have left? My lining is always good, around 12 millimeters. My partner's sperm and frag is great, and all my tests, Dr. Rand, came back normal, including karyotype and blood clotting tests, etc. Thank you.
Right. Yeah. So this is recurrent early miscarriage, and it sounds like you've had the bulk of the tests done that I would do. Someone mentioned earlier about doing immune therapy. So immune testing is worthwhile doing. Some doctors don't believe in it and therefore don't do it. I always go looking for it and just to be sure. The other thing I would be questioning. Basically, for an embryo to implant, your immune system has to accept it. The blood flow to the uterus has to be good. The shape of the uterus and any damage inside the uterus must be excluded. And also, although it's rare, you can have inflammation of the lining of the womb, endometritis it's called, which can impair both implantation and cause early pregnancy loss. So I would be suggesting that you have a hysteroscopy, that's looking inside the uterus with a telescope to make sure the cavity is normal, and also to do a curette, a scrape out of the lining of the womb, so we can look at the pathology and make sure you don't have endometritis. And at the same time, we can also look at the immune cells in the lining of the womb. And we have some notions about what a normal pattern of the immune cells is. So, maybe there's more to look at.
And don't forget that you can access all the previous episodes by going to our website, www.theivfjourney.com, and select IVF Journey podcast from the navigation menu.